It's way better to have teeth and way nicer to be able to smile without your teeth falling out. And it's so nice to be able to chew food without a denture hurting you or a denture flopping around in your mouth while you're trying to eat. So there's multiple options with implant dentistry today. Either an implant supported denture or a denture that's totally screwed into the implants and never comes out. One that's just an overdenture clicked onto implants, comes in and out. It's super stable. But some people don't want to take something in and out of their mouth. They want it permanently in. That's a big difference. The process for full arch surgery requires diagnostic data up front. You remove the teeth, you place the implants in the proper spots, and you put in the prosthetic and convert that very day. Patient walks in with missing teeth and they walk out with a full arch, totally restored, and they're able to eat that day.